welcome to the India Climate Dialogues, hosted by the City Climate Alliance at the National Institute of Urban Affairs in collaboration with Asar Social Impact Advisors. The India Climate Dialogue is an ongoing dialogue series with our Alliance Network partners, where together we attempt to create meaningful and actionable conversations. While climate change gets majority international focus, air pollution and its health burden the health burden it poses to the economy are challenges India faces here and now. Addressing the challenge of air pollution has implications for India's climate mitigation too, and it is important for us to find the synergies between the two. For instance, large-scale adoption of public transit and non-motorized transit, that is walking and cycling, can significantly reduce India's growing greenhouse gas footprint and at the same time deliver immense reductions in exposure to harmful particulate matter and gaseous pollutants to urban and rural residents alike. Equally, addressing clean cooking needs of rural households can offset the use of polluting solid fuels, improving health outcomes for women and children, and believe it or not, deliver climate positive outcomes. To set the central theme for the discussion, we have Vandana Chavan, Member of Parliament, Rajya Sabha, and the former Mayor of Pune, delivering a keynote speech.
Today, when we are talking about saving the hills of Pune, whether it's public transportation, it's all basically working towards reducing your carbon emissions. Every municipal corporation is mandated to bring out an environment status report, an ESR. So when I was a mayor, that was the first year that Pune was the first city in India to have tabled an environment status report. It was just a 20-page, very basic document. But today it's a proper 200 pages, well studied, with a lot of data, statistics, document that comes out every year on 31st of July. Again, we were the first municipal corporation to have incorporated a chapter on global warming in one particular year. That was the first time, again, nobody else was talking about it. No municipal corporation was talking about it. And then after that, we moved a step ahead, and that was about doing a carbon inventory for a city. TERI, the organization from Delhi, did it. And again, we became the first city to have mapped which were the sources which really polluted the cities and the carbon emissions happened. Except for the flights which came in and out of Pune, everything was mapped. And therefore, the municipal corporation started working in that direction as to what are the issues that we have to address. As far as individual properties are concerned, and that was the first time when, again, we became the first city to have offered a 20% rebate on the property tax if there were steps like solar panels, vermicomposting pits, or decentralized sewage treatment plants put in, or rainwater harvesting put in, then the societies would get a 20% rebate in the property tax. I think what's very important now is to sensitize local governments. We've heard of Agenda 21 under the Rio conference. The Agenda 21 said exactly this, that think globally, act locally. So the action has to happen at local level, because that's where you have to address to bring down your carbon emission. The local governments are unfortunately not sensitized enough to address the developmental issues through the lens of sustainability or climate change. You look at any project that happens, whether it's a road, whether it's a drainage system, whether it's a construction happening, the layout of a particular township, all this is not at all looked from the lens of sustainability. And that's something which is very important. We did a workshop for engineers from the municipal corporation, and we gave them a background about what climate change is and how every developmental project will have to be seen from the lens of sustainability. Unfortunately, they did not know anything about, sad to say, but climate change, nothing about adaptation, mitigation, and how we need to move forward in that direction. So we have a huge task to reach out to all these people if we really want to see climate change being addressed by all of them. Thank you.
Thank you for the opening address, Vandana. It was great to hear of all these interventions and the drivers for your own actions in this area. To discuss the topic further, we have three eminent researchers, policy practitioners, and citizen movement leaders with us. We have Dr. Anjal Prakash, Research Director, Bharati Institute of Public Policy, Indian School of Business. We have Dr. Pallavi Pant, Head of Global Health, Health Effects Institute in the USA, and Ranjit Gadgil, Program Director at Parisar, an environmental NGO based out of Pune. And to help us shepherd the conversation, I'm your moderator, Karthik Ganesan, Fellow and Director, Research Coordination at the Council on Energy, Environment and Water, a not-for-profit policy research organization based here in New Delhi. Welcome, everyone. Pallavi, the question that I had for you was, what are the challenges of linking what's happening today by virtue of the poor air quality that we are seeing in cities and areas across the world, and what we're doing with regard to climate change? Because the action, of course, seems to be more climate change oriented, but we clearly know that there's a potential for climate change and air pollution to be spoken about in the same breath. How do you see that integration happening in the way you're communicating and also looking for policymakers to address it?
I think this year has been pretty interesting if you think about climate and air pollution, because in many parts of the world, we've seen extreme weather events that have also resulted in poor air quality. So in the US earlier this year, there were massive wildfires, or actually the wildfires that happened in Canada, and meant that there was poor air quality in many parts of the US. And for several days, people in this part of the world really experienced what poor air quality is like for many other people in many other parts of the world. And at a different time in a different part of the world, we had extreme heat events, which meant there was bad air quality again because of pollutants like ozone. So I think this year has really been a very good example of how the air quality problem and the climate change problem are very deeply interlinked. We have known about it for a while, but I think in the way the problem has been framed, when we think of air pollution, we think air pollutants like PM 2.5 and nitrogen dioxide. When we think of climate change, we think of greenhouse gases, carbon dioxide, methane, etc. But what really connects them at the core is that the sources for both are very similar. It's primarily combustion-related, emissions that are resulting in bad air quality, that are resulting in increased greenhouse gas emissions. So I think the last few years have actually been the time when people have consciously started connecting air quality and climate action, both by highlighting the fact that, as we see the results of climate change on a day-to-day basis, we will probably see air quality worsen in many parts of the world. It could also mean that, there's more like dust events. It could mean there's more extreme heat events, all of which means higher exposures to air pollution. And really the connection with regard to sources, so that we're focusing on the sources, but in a way that can help us address both air pollution and climate. And ultimately, our goal always is, how do we make it sort of better for people to live and enjoy their life, improve quality of life. So health, of course, is a component. But I think thinking about air quality action and climate action, some integration is beginning to happen. But still there are, sort of siloed ways of thinking about it. So as we move forward, I think there is a need to very consciously couple those two together to the extent possible, because actions are similar and are going to lead us to similar outcomes in terms of improvements in air quality, reduced greenhouse gas emissions, and ultimately better health for people.
That was really good to hear, and I see what you're saying, right? That this year, of course, the West faced what I think developing countries see on a regular basis. Anjal, coming to you, what I've always heard, from the research that many leading entities in India have undertaken, right? They pose air pollution or air quality improvement as sort of like a co-benefit of climate mitigation. That is one way in which we've sort of looked at air quality improvements in India. But I've always argued that as far as India is concerned, right, it probably is air pollution first, and then as it if that addresses climate mitigation considerations for the rest of the globe, because as the burden of climate mitigation is disproportionately on India today. then that's better. But do you feel that it's easier to sort of address air quality head on in the Indian context because, there are more drivers for it, given the local significance? Or do you feel that, it's more sort of still a very climate change related, driven discussion that's happening in the policy circles today?
That's an interesting question, Karthik. See, we must first see the background. See, the cities of the earth actually only have about 2% in terms of geographical space, but they consume about 78% of world's energy and produce more than 60% of the greenhouse gas emission. And that's the context in which we are talking about. So cities are definitely engine of growth, but at the same time, they're also a major pollution, engine also for the world, right? So this is where we are trying to see what has been, whether, this is like a chicken and egg situation, whether we want to look at mitigation, but fortunately, I've been part of the recent IPCC report. And then one thing that all the scientists agreed that, earlier when 10 years before, when we were discussing about climate change, we were saying we must focus on adaptation. But I think the recent report has said mitigation first, and mitigation is something which has to go hand in hand with climate change adaptation, and that's where we must situate air pollution in. Let me just focus on what are the things, how do we tackle these issues, and let me focus on 5 points. The first is definitely about the immediate health gain. So if we are focusing on reducing air pollution and greenhouse gas emissions, that leads to immediate improvement in air quality, resulting in fewer respiratory and cardiovascular diseases, and ultimately saving lives and millions of people who are being affected. Second is about resilience building. We also know that climate change exacerbates health risks through extreme weather events and the spread of diseases. So the public health-driven approach involves adapting to these changes and also building community resilience. Third point is about cost saving. When we are preventing a health pollution-related illness and injuries, that reduces healthcare cost, and also a cleaner energy and transportation that can lead to much larger economic benefit for the larger society. The fourth point about co-benefit, and you've discussed, I think this is an important point, that many measures to mitigate climate change, such as transitioning to clean energy and reducing emission, also reducing air pollution, resulting in what we call the co-benefit or dual benefit for the public health. The last point is also about community engagement. I think this is something that we have not been tackling much, but I think emphasizing health connects with people on a personal level and encouraging community involvement in mitigation effort is important for us to take these issues further. So this is what I would say in, overall, making public health as a driver of mitigation should align with environmental and human health goals, improving well-being and saving lives and millions of people who have been affected, especially in the global south, and also promoting what we call the sustainability and resilient future.
Thank you. You've already, obviously taken the discussion forward and, invoked health here. But Ranjit, before we sort of jump, full scale into the health related aspects, to what extent do you feel urban India, of course, Parisar, Ranjit, you work with Parisar, which is an NGO that is, based out of Pune on really environmental issues, not limited, of course, Pune, but which speak to the emerging issues that we have. To what extent do you feel the urban crowd that we have in India today able to relate what they're seeing by way of, air pollution, which is, of course, perceptible immediately, to the way their cities have developed and the way, that we've become more dependent, for instance, on what Pallavi is talking about, which is, that increasing use of energy from sources that are basically giving us pollution as an outcome. Are people able to sort of put this together and sort of see that things were different earlier? Of course, we had much lower level of services of everything, right? Quality of life in some way was also poorer. Today we have better. But are you seeing that, the discussion where that relationship between how we've sort of grown as an economy has had implications in the urban areas? Yeah.
It's really important to try and understand what, how does the public imagination work around this? And that's why this question that you asked is so important. People, of course, are seeing air pollution increasingly because of a couple of things. Not only are we seeing higher levels of air pollution, we are seeing a lot more reporting on it from the media, we're seeing a lot of reporting in the media on the health impacts of air pollution. So at least that's entering into the public consciousness. And then of course, there's the role that NGOs like ours play in trying to further take that message forward. Because unfortunately, both air pollution and climate change are, in a sense, these invisible impacts on people. People don't really see, they don't really physically see air pollution. When a city floods, for instance, which could be another outcome of climate change, that's something that people understand. It has physical implications. The media covers that. There's a certain impact that people have on that. It displaces people. Air pollution, as everybody has been saying a long time, is a silent killer. You don't really see it having an impact on you. The more immediate impacts is something that, of course, immediately people start talking about. In fact, right now we're looking at some pretty bad air quality in cities like Mumbai and Pune also. Of course, Delhi is a perennial story. And it starts affecting people's respiratory systems. You see a lot more reporting on coughs and colds and those sort of standard ailments. And so people make that connection. Post Diwali, for instance, often people complain about the bad air quality. The real difficult part is to convey that poor air quality, even at levels less than that, has more pernicious and long-lasting impacts on people's health. That's been a little difficult to get across to people, especially some of the other health impacts that now are becoming evident. With climate change, making that connection is even more difficult because those are much more longer in terms of their time dimension. The causes of climate change are not necessarily located in the city. We're talking about high consumption patterns in the city, which is what Anjal mentioned, but not necessarily the places where these products or the energy is being produced. And so the cities don't see themselves as being necessarily responsible. And then you see figures that say that cities aren't really responsible for the overall, carbon emissions. So, yeah, I think with air pollution, it's been a little more tangible. With climate change, I think we are going to have to work a little bit harder to make sure that people understand that the fundamental ways in which the city grows, develops, and the kinds of policy decisions that we're taking in the city today, whether it's how the urban form evolves, what sort of transport systems you put in place, how do you decide to manage your waste, will have long-term implications for the climate. And again, people may be more interested in the adaptation and the resilience parts than they would be in the mitigation parts, because mitigation really means making trade-offs, and I don't know. Some of these trade-offs are hard trade-offs, whereas with mitigation and resilience, again, I think the responsibility becomes either of the urban local body, which has to either flood-proof your city or whatever else it needs to do, so that you can carry on more or less with business as usual. I mean, some of that is changing, but I think some of those changes are also much harder to institute.
Thank you, Ranjit. I think you bring about some very interesting points. And talking about how people relate to it, I remember I was walking through one of the gardens here, and we were kind of doing an assessment impromptu of the lay persons in the city to understand what they think of source of air pollution. I asked a bunch of people sitting around in Lodi Gardens here in Delhi, what do you think is a major cause of air pollution? And and you won't believe it, quite a few people actually said air conditioners. For some reason, they just attributed the fact that an air conditioner was spewing out something as it was cooling that was causing air pollution. So the sources aren't clear. And many people, of course, talked about vehicles, but really there was very poor understanding of what the fundamental source of air pollution were. So I think I'm not sure whether air pollution also is as clear in the minds, but as you said, climate change certainly, I think there's a lot more to be done. Pallavi, I'm going to sort of come back to you, and both Anjal and Ranjit have invoked the health angle, and that's of course your bread and butter. Tell us this: does the average policymaker in a developing country setting, do they see that there is a significant potential for health to be used as a lever to address, to basically take on mitigation efforts, whether it's for climate change or for air pollution? And we think, at least as researchers, we think there's enough evidence. but what do you see as the major pushback in using the health impacts story to drive action in this? I mean, and is that established or is that not in the minds of the policymakers in the South? Over to you, Pallavi.
Yeah, thank you. I think, this has been a question that a lot of people in this space have been wrestling with. And I think there's two pieces to it. I think one is our understanding of how air pollution or climate change may be impacting our health. As Ranjit pointed out, it's sometimes very nebulous to make that connection between what you may be breathing or, how your environment may be affecting you and how that might mean that you have a certain health effect or you experience a disease and it's connected to these exposures. But in terms of the science, there's obviously been a lot of progress in the last 2 to 3 decades, in particular, both in understanding how air pollution is affecting our body and different organ systems, but also in trying to project what that means for the future. We have a sense of what business as usual might look like and what it might mean if there were mitigation measures put in place to address air pollution. And there's a second piece to it, which I think, even as a community, we don't talk about as much, which is that if we focus just on air pollution for a minute, all of the, health impact numbers we see are not just a product of what we are getting exposed to. That's obviously a big piece. The other big piece is, demographic, like how young or how old is our population, how healthy is our population, because that is going to also have implications on how soon you're going to see those big, health impacts. And if now we just concentrate on India, we've been at a stage where our population has been growing, so we have a lot of young people, but we are soon going to enter that stage where there are going to be more older people. And in this case, I'm not talking about 70-year-olds. I'm just saying adult population is going to get bigger and bigger in size. That also means that these are now people who've been exposed to air pollution, other stressors for some decades in their life already. So our health policy is, trying to think about it. The government is thinking about the non-communicable disease burden that's growing and getting even bigger. But we haven't made that connection that any exposures that are happening now will potentially have that impact. When we add climate on top of it, that's when we start to make the problem even worse. Just this year, we, with the heat events, and last year also, we had these major heat events in India. People died as a result of heat exposure. And what's happening in most places is this interaction between you're getting exposed to extreme heat, you have no means of, sort of addressing that. You're also getting exposed to pollution at the same time. So that combination can have even worse health impacts. And I think, as far as I understand the policymaker perspective to a limited extent, there always tends to be some understanding, but I think there's a lot of questions too, in terms of, especially how the big health impact numbers come about. Is this evidence relevant for me and the population I'm serving? So yes, I think there's still a bit of a sort of, gap between making health impacts the central driver or a key driver for any climate or air quality action we're taking. I think we're still at a stage where it's really about, emissions, air pollution control, not so much about health. But hopefully we are on that path where health is becoming an important driver, because we will need to start taking it very seriously, especially as any, climate-related events start getting bigger. What's the surveillance systems, health surveillance systems we have in place? How do our hospitals cope with, sort of increases during periods where you might have higher exposures? Ranjit mentioned flooding. Another kind of example, cyclones are becoming more intense, right? So all of that connects back to health in some way. But I think so far our policy efforts have focused more from the pollution management lens or the climate mitigation lens, and health has not been a very central piece. This is my understanding.
Anjal, I'm going to come to you on this. So one of the things that we've seen is that because the mitigation is in the hands, and mitigation and the budgets for mitigation, etc., are in the hands of the other agencies, right? Whether it's the environments and forests, or the industries, or the transport ministries, or whoever it might be, right? They don't necessarily see that there is this big health component, right? Whereas there is obviously a benefit to be had, because if you were to actually integrate the budgets associated with health and the cost that health actually imposes on the economy, poor health, you would see that you can actually improve productivity and outcomes across all different sectors, and as a result, you're freeing up more money for investing in more productive interventions. How do you feel this can be accomplished on the basis of your work that you've done in other areas? Do you feel that there is a way in which we can bring together different ministries to think about this and possibly value life more, right? I mean, sometimes I feel like we just don't value life enough in India, right? Especially at this time, when we have so many wars and everything else happening. Clearly, the value for human life seems to be very low. But in India in general, because of what we see, right? Whether it's the air pollution related deaths, or the traffic related deaths, right? Road deaths, etc. So it feels like it's on the lower side. So how do you feel, we can bring that in, Anjal? Yeah.
You have actually scratched the thing which I've been telling for a long time. It's something that I have been advocating and trying to get across for a large number of people through my writing as well as in the popular media. See, in India, the major problem for tackling climate change is institutional in nature. And I have been advocating for a long time that we must carve out a Ministry for Climate Change. All the progressive nations have actually done that. And this is not climate change is cutting across all other sectors. So I'm not saying that you need to have climate scientists heading those places. One. Second is that you need to have a lot more coordination. That means the climate change ministry should coordinate with all other ministries, because this is cutting, including women and child welfare, including transport ministry, all across, so that's the major problem. And if you this is at the central level, but if you actually take it down to the state and the federal level, the big situation becomes much more problematic, because we don't know where to go, who is accountable for lack of adaptation or lack of mitigation, or public health problems that I face because of air pollution. Now that's where the major problem lies, and that is, I think, largely institutional, because we have not been able to cater to the problem from the government side. That's number one. Second part is about how we could take other people along, other stakeholders along, and that has also not happened. Sorry, you have other stakeholders, for example, community. You have scientific community, huge scientific community, who's waiting to be approached to give you proper implementation, a proper scientific understanding of how things should be going about. So this is a tripartite agreement needed, where you have scientific community at one point, community involvement the second point, and third is the bureaucrat, the people who should be taking action against some of these problems that you've specified. So this is not going to happen unless there is a huge institutional change. That is what I would put forward.
Right. Ranjit, moving on to you, obviously, as entities that are looking to find solutions to this, and you engage a lot with the citizens, Ranjit, and there is, of course, a level of apathy among citizens as well, right, when it comes to a lot of these issues, whether it is, urban areas, more so probably in urban areas, because we're all quite caught up in our daily rigmarole. But given that you extensively engage with communities to try and sort of get them to adopt, whether it is cycling or buses, what do you feel is the future? I mean, do you feel that a future which is just delegated to an executive and a legislature, right, will deliver for us our outcomes, or do you feel that active citizen participation is what is needed to get the outcomes that we need?
I mean, it's a cliche to say that active citizen participation is required, and that requires that citizenry to be aware of the issue. I would sort of turn this around, Karthik, a little bit. I would say that even though a lot more work needs to be done, I think there's still, in all our large metros, which are primarily facing this issue at a much more elevated level, I would say that there's still a sizable number of citizens who are aware of the issue and who are actually demanding a change. And you can go from city to city and you'll find a lot of people who are actually worried about this issue. I think I would like to build on what Anjal said a little bit earlier, is that this is really an institutional issue. Who will solve this problem? Let's say that there's enough citizens who say that, we're living in a city which is breaching the air quality, healthy air quality levels on a regular basis. Who takes action? Who is best equipped to do this? And while there are certainly issues, genuine issues, which were laid out earlier in terms of who is responsible, I think cities is one place where I feel that this can come together. We've all been talking about more empowered cities, cities that can be not just the engines of growth, but also the locations where decisions can be made. And here, I think there are some reforms that are critically required. One is that, of course, most cities tend to work on the basis of directives that are handed down to them by the state government. So if it's not there from the state, there are very few cities who will take initiative on their own to institute some programmatic changes. In spite of that, cities have tried to do that, even though they don't have a directive from the state government. Cities, because they're feeling the pressure from the elected representatives, are saying we need to do something about the air pollution issue. And in fact, even though cities don't necessarily make this linkage between health and air pollution, because there's a bit of a silo over there, cities' health is related a lot to communicable diseases. So it's immunizations, it's these kinds of programs that they are very well versed with. To try and link this to air pollution is a little bit of it's a next step for them. However, cities are aware that they can do a lot to mitigate the emissions themselves. And some of the things that we talked about, transport systems, waste management, or construction, for instance, pollution from that is emerging as another issue. Even if the cities were to take very concrete and immediate steps to try and reduce the emissions from these three sources, cities would improve. It wouldn't solve the problem completely. They wouldn't be able to solve, for instance, the regional level problems, but they'll definitely be able to take some concrete steps on the local emissions. And here's where I think cities need to do more. Cities are finding it difficult to put money into good bus systems, for instance. But think about the way the national government was able to push metro systems across cities, not all the cities, because of the cost involved, but definitely it was something, therefore, that cities were able to do. And I'm sure they're reaping some benefits from a cleaner mode of transport and trying to get more people to use that rather than using their personal vehicles. I think a lot has been done at the cities to try and promote more electric vehicles, though not enough has been done, for instance, to cap the number of polluting vehicles, because unless you do that, you will still keep getting higher levels of air pollution. So I really see the city as the place where a lot more action can be taken. They can be more responsive to the needs of citizens. I think all citizens are upset when they see garbage being burned. They may or may not understand the implications, but I think at an intuitive level, they know that this isn't right. This is certainly not healthy for them. And cities certainly can do a lot more in terms of the systems that they completely control. This will require, I think, institutes to be able to put out enough guidelines and frameworks which could really help cities to address this problem in a more systemic manner, to understand where money should be put into, what are some of the false solutions that they perhaps shouldn't pursue. Those kinds of guidelines, I think, will help cities to understand how to tackle this problem better.
Thank you, Ranjit. What I also meant to ask you, while I see the point that, that certainly it's about institutions, about guidelines that are put in. What I was also alluding to is a lot of issues that we see, right? For instance, you talked about, last mile connectivity, whether it's to, existing public transport systems or the way waste is managed. It is really, in and around you. And if you see that certain systems are not functioning, it is the role of the citizen to sort of, ask the executive that represents, that particular area to get it fixed. But if the ask is not there from the citizen, then, that system just degrades. And then, once, a new method or whatever, comes in, it's very difficult to go back to what is the best practice. So for instance, whether it's cycling lanes, whether it's even walking lanes in a particular city. And I face that constantly, in my area. But I think your points are well noted here. Pallavi, I mean, I want to sort of move to you for sort of like the last round of questions that we have. You've of course been tracking and commenting on, what the National Clean Air Plan has had to say and do, right, when it comes to impacting air quality across, the 130 plus non-attainment cities in India. What would your recommendation be to sort of really accelerate the pace at which action is happening, whether it's under the NCAP or under a revamped version of it? Yeah.
I think, one thing I will say with all of the sort of, shortcomings that NCAP has, one thing that it did do was mobilize state and city level action in a way that didn't exist before NCAP came about. We had always these like national programs, or they were very Delhi-centric programs because of the attention that the problem in Delhi has received. And while that's important, India is a very big country. So I think the National Clean Air Program with the 130 plus non-attainment cities has actually put the spotlight to some extent on all of the places beyond Delhi that are experiencing the air pollution problem. It has also created to some degree, like knowledge transfer that has happened or is in the process of happening in terms of what do we know about the issues in the city, what are the sources, how do we fix them? And it's been very uneven from state to state, so I think it's hard to lump them all together. But there has also been a separate development outside NCAP that I just want to draw our attention to. And I want to highlight two examples. One is Ahmedabad, where in the last few years, there's been very concerted effort to try and build air quality action plan and heat action plan and do them in a way that they're complementary and, they speak to each other. They're not done in, separate, by separate people in separate departments. The second example I want to highlight is from Bangalore, where there has been, time and attention paid to how do we build like an air quality and climate change action plan for the city together. So if I look at, what NCAP has been able to do, like get the attention to the city, to some cities, there's money coming in now. It's connected with performance, which, puts like an added layer of sort of accountability. And separately, there are starting to be good examples from within India. We don't even need to look outside India. And then, if we start going sector by sector, I'm sure there are other examples that we can show. Indore with waste, for example, and, other cities with transport. So I think what would really help move this forward, in my view, is trying to take those examples and cases where things have been done and they've worked and find ways to replicate it. But starting to highlight these examples more on how this was done, what can your city do to adapt a plan like that? What would need to be modified? And then, at the end of the day, I think a lot of things move with the money. So action comes where money is available, or there's a hook that if action isn't taken, the money is going to get taken away. And I'm not an expert on, how those instruments work, but I think there's a need for some level of connecting resource allocation with actions that are or aren't being taken, and use that to spur the move, spur action. But recognizing that, as Anjal mentioned, there's often disconnect between who's in the department making the decision and where's the science to back it or where's the information to back it. So also we need to create some channels for better integration of scientific information into the decision making. Otherwise, we end up with, stopgap solutions, like a lot of cities under NCAP are just controlling dust to, incentivize action across line departments, and then also creating very sustainable pipelines for data transfer between scientific research organizations, think tanks, and the city departments that are going to then take the action.
I think that was a good set of interventions there, Pallavi. Anjal, I have a good proposition for you. You've seen this movie called Nayak? Yeah. There's this guy who gets made CM for a day, right? So Anjal, for the next minute and a half, you're going to be the CM of a chosen state. And, since you sort of, you've observed a lot of these institutions at close quarters and you had suggestions, if I were to say, that you were forget CM, right? You were somebody in a position of power, right? And if I asked you to sort of recalibrate institutions and the way things get done to address, and climate change in a concerted manner, what would you think is one way in which, you could at least make tangible progress?
Yeah, interesting question though. See, I'll focus on 5 things, which is important. And here we are talking about intersection of air pollution, climate change, health impacts, and the climate stresses that we have, all together. So it's like a combination of these issues that we're talking about: mitigation and adaptation to climate change in relation to the health and the air pollution, the health outcomes that we have. So let me focus on 5 areas. First and foremost is about data integration. I think we must gather and analyze the research data on air quality, health impact, and climate stresses all together, and combine this data from various sources, including the local studies and the global research that we have. Global research is going to give you trends of how things are moving across, and the local studies are going to give you bottom-up approaches. So that's one about data integration. The second, and in this point I made earlier, is also about multi-stakeholder collaboration. That means we must involve the local government, the health authorities, environmental agencies, and the scientific experts in the policy making process. Third is we need to urgently do risk assessment. That means we have to assess the specific risk and vulnerabilities of the city's population, especially the poor and the marginalized, who are disbenefited by the whole process in relation to pollution and climate change, and identifying the risk areas as well as the groups that we have. The fourth point is that bringing down what the whole issue has to be tackled from the public health perspective. That means we must prioritize public health in policy making, and policy should aim at reducing health risk associated with air pollution, such as respiratory disease, and enhance what we call the resilience to climate change related health threats that we have. And Pallavi has given a very good example of how we can do that. So it's not that it's an alien thing, we have done it, we can do it. And the last point I would say also about emission reduction strategies. We must develop strategies to reduce emission from various sources, such as transportation, industry, and these are long-term issues, and energy production that we have. So we must implement measures like clean energy adoption, green transportation, and what we call the pollution control technologies. These are the 5 things I would do if I not say CM, I say the PM of the day. Thank you.
Right. Thank you, Anshul. And Ranjit, to cap it off, as I said, going back to the work that you do, right? It is indeed sort of ultimately trying to work with communities, right? You have to try and impact it. I know Parisar is very embedded in the way Pune is thinking about making things sustainable, as you also heard from Vandana earlier on. So you've obviously you've got experience of what Pune has done well, what it may not have done well, right? And I know cities in parts of Maharashtra have always sort of been the ones that have been the bellwethers for sustainable action, right? There has been that inherent need sort of to remain sustainable, which I think a lot of other cities can draw from. What do you see as really replicable? Because I mean, ultimately, it'll require tailored solutions across different cities because of various different endowments that they have and don't have. But what do you see as immediately being replicable in the context of things you've seen work, whether it's in Pune or geographies that you've touched in, that we can adopt sooner than later, so that we at least have some easy wins to showcase the citizens on overall, air pollution or climate change mitigation? Yeah.
Climate change mitigation is going to be a challenge. I think one of the things that I've been saying is that we're very interested in making climate action plans. Unfortunately, there isn't a statutory framework by which those plans have any real teeth. And so somebody needs to start looking at how do we embed this within the framework. And I think what Pallavi said earlier was important, that NCAP, essentially by providing the money and the framework and a target, it sort of held cities accountable. There was money available. It no longer became just some sort of a plan that somebody has helped us make, and then we move on. Cities have master plans or development plans, and unless there's a way to integrate those two together. So I think that's going to require a lot more thought. Also, the country seems to be focused on climate change mitigations that are more the the big wins. It's going to be energy production, it's going to be industry, and that makes sense. But at the city level, I think a lot more needs to be done. In terms of replicability, I think a couple of things that come to mind. I mean, I think, I definitely like to say that we've done pretty decently in terms of at least taking some steps forward in terms of transportation. It was a culmination of many things that have happened over the decades, but Pune was one of the first cities to introduce the bus rapid transit system. That comes with a lot of difficulties in terms of taking space away from motorized vehicles. But I think a no-brainer is improving public transport and not waiting for the metro system. The metro will happen when it happens and all cities want it, but bus-based systems can do wonders for the city. An interesting development in Maharashtra was the earlier environment minister actually said, why not allocate 80% of the NCAP funding just to improve public transport in all the cities? It was a bit of a magic bullet solution. And a lot of cities didn't like the fact that they weren't able to localize their spending on air quality. But I think in some ways he identified that we know that vehicular emissions are a major contributor to air pollution. We know that most cities have highly deficient public transport systems, and it has co-benefits. Of course, it improves the economy. It helps people in their mobility. So those kinds of solutions, I think, are something to definitely think about. Pune and Mumbai have fairly decent public transport systems, shared mobility systems that needs to be that could be replicated. Pallavi mentioned Indore as an example of probably good waste management, but Pune, for instance, has been at the forefront of this decentralized waste management system. The waste pickers are completely integrated, formally integrated with the Pune Municipal Corporation in terms of the collection. And people like Vandana and others have sort of played a role in making sure that happened, which means that we have greater levels of segregation, which definitely helps reduce waste to landfills and therefore all the emissions that come from there, both in terms of air pollution related as well as climate driving gases. Another thing that has recently happened, it's a recent development, but I think there's something to be said for that. And I think Vandana mentioned that earlier about the lack of understanding about climate and their work when she held a session with the engineers. But what the commissioner of the neighboring city of Pimpri-Chinchwad has done is that he has tried to set up a sustainability cell within the municipal corporation, which now means that every development project gets submitted to the sustainability cell. They try to ensure that some of the things that we talked about, if you're doing multi-level parking, or if you're doing a new sewage treatment plant, have you really incorporated some of the sustainability angles into that? Have you tried to reduce energy consumption? Have you tried to ensure that other impacts don't happen? And then the department will take it forward. I think these are really innovative ideas. It's come from a young bureaucrat who's currently the commissioner there. It would be interesting to see how that idea evolves. But yeah, these are some of the thoughts that come to my mind right away.
With that, we come to the end of a very interesting discussion today. There is obviously a lot of linkages between climate change, air pollution, and human health. For instance, in taking on from Ranjit's last point, a simple thing like walking the last mile or walking significantly to get to your transport also gets you to be a more active citizen, right? Active mobility, as they call it, which has implications for your overall base level of health, right? Which can then contribute to your ability to be more resilient to the external forces that air pollution and climate change are imposing on you. So I think to be able to see that linkage between what we do on a daily basis to keep ourselves healthy and itself automatically has positive implications for mitigating both air pollution and climate change. So it's not clearly something that's just being imposed on us. It's really also what we are imposing on the environment. And I hope, with that, we are all take the oath to sort of really, look at individual actions, as we look to the outside policymakers to act on our behalf. Thank you to all the panelists for sparing, precious time. All the viewers who have tuned in, please stay tuned in for more such interesting discussion from the City Climate Alliance at the India Climate Dialogues that is run by the National Institute of Urban Affairs. Thank you very much. Signing off for the day. Thank you.